Hi, I'm Natalie Michaels, editor of Tulsa Kids Magazine. Welcome to PJ's Corner, where parents can find answers to medical questions about their kids. Look for it in print or at tulsakids.com. We have with us today Dr. Barry Berch. Dr. Berch is Medical Director of Pediatric Surgery at the St. Francis Children's Hospital. He is a board certified pediatric surgeon with fellowship training from Vanderbilt Children's Hospital. He performs a wide range of surgical procedures for children, from newborns to adolescents. He's here to talk about what parents should know if their child needs surgery. Welcome, Dr. Berch.
Thank you. It's a pleasure.
We're glad you're here. You know, I've been on the other side of things, knowing I've been through surgery with my children, so I know how that feels, that immediate, there's some understandable fear when you first hear. I wonder if you could tell us what's the first thing you'd tell a parent when they find out their child needs surgery?
Yeah, I think there is, and just I think that's a big part of kind of the training and the background of not just myself, but all the people of a children's hospital that know how to handle and are looking for opportunities to put this parent as well as their child at ease in this really difficult moment that is really hard to put into words. And so I think it's just a recognition that that fear is there, and how to provide comfort to them, whether it's words like "we do this all the time," and I know this is scary, and it's just trying to really explain what's about to happen, in details of the surgery, as well as just expectations of how we'll make this comfortable for them and their child, and just it's just this global education of the situation. And obviously, that's easy to do here at the Children's Hospital because we do kids all the time, and our whole everything around us we're surrounded by is all to help put address these fears and put children at ease and their parents.
I wonder, I know there are probably some common mistakes that parents might want to avoid when preparing for their child's surgery, thinking about maybe delaying their care or some other issues like that.
Yeah, I think just common mistakes are just that I see are just the assumptions that I mean, you could go, I could address this from a number of ways, but I think some mistakes are just the assumption that where I'm going to have my child's surgery doesn't matter. Okay, in terms of the facility, there's obviously many options. Clearly, we're biased of the St. Francis Children's Hospital because we love it and think it's great, but it's just it's mistakes of not realizing children's health care is profoundly different, and not just any medical center or healthcare center or urgent care across the city really understands children, their pathology, their diseases, the things, the way their anatomy is, the way they present with different illnesses, certainly surgical conditions, and so those are mistakes I see a good bit. Is just kids end up too many times at the wrong place first, and I would just like to emphasize that if when a child's having problems, seeing pediatricians or family doctors that take care of kids, and if it's something urgent, something they're considering surgery for, just really making sure that they're at children's centered institutions, and pediatric urgent cares, and getting to a true pediatric emergency room where pediatricians and specialists that understand the things to look for in kids. And then ultimately, when it comes to surgery, it's not just about the surgeon, it's the entire system that's able to get that kid through an operation, a surgery. And for example, here at St. Francis, we have just an entire team, peds anesthesia, a pediatric OR team of nurses, surgical techs, child life, the pre-op nurses, the recovery room nurses, all that are, they do kids every day. And that's what, creates uh, good outcomes, safe care, and the best care for children.
That's really interesting that about it being more than about one person, more than about one physician or one nurse, that it's the
Yeah.
whole system working together.
Yeah, I think medicine very clearly, medicine, surgery because that's what I do. But it's truly a team sport.
Hmm.
It's not, you know, golf or tennis or these individual sports. It's a true team sport. Like you watch our Oklahoma City Thunder, which I know all of us love. I mean, why are they so great? Is they're such an amazing team, and just
Right.
the way they all work together to win every night. And anyway, our children's hospital, or most all hospital systems. I mean, the way you get patients through things, or having the right team of people that are all specialty trained to manage those conditions. And I think children's healthcare, as much as any other area of medicine or surgery, is where it's a really good example of that.
Hmm. That's great.
Yeah.
We talked about some of the don'ts. I wonder if you could tell me about some of the do's before surgery, maybe questions a parent should ask or other things that could help the process.
Yes, I think you know, as a parent, there's just do your due diligence. Make sure that where you're going is a children's healthcare system. It's a system set up to take care of a kid. I mean, understand the credentials of who you're going to see, and to take it serious and not just assume that where you're going or where you're taking your kid is the right place for children. So again, the do's are to do their due diligence, and make sure that they're going to the right places and being seen by the right people.
I know we talked about the people in the hospital, but I wonder about some of the other specific things that are specialized for children, maybe special equipment or other things parents might want to know.
Yes, you know, in terms of just some of the other services that most children's hospitals have. I mean, we at St. Francis are blessed to have like a child life service, and they are wonderful at meeting with families and being around, especially our surgical patients, where they're able to take the kid's mind off of things, and provide different things for them, whether it's games that they play, and just put them at ease and just take away some of the fear and just of this being this big bad scary place. And so I just can't overemphasize how important they are, that we have that we're able to have at a children's hospital. I think in terms of just equipment, you know, we're taking care of babies that are literally as small as my hand, all the way to teenagers that are as big as myself. And so it does require a lot of different, whether it's the IVs being put in their hand and how they're able to use ultrasound and different techniques to get these IVs in little babies, to just all the equipment we have in an operating room, and the different tubes and supplies that anesthesia has, that we have to have so many different sizes to fit every size baby. I mean, you just think about it, from a newborn to a 1 year old, they're three times difference in size. And so um, all those things, by coming to a children's, whether it starts in the emergency room and the equipment, the PZR and the equipment they have in there to take care of a sick child, a sick baby, and able to do these things right away, that they have all these supplies that fit every size patient, literally, as
Mm-hmm.
opposed to, showing up at the wrong emergency room or wrong healthcare center, where you're almost making do with adult size equipment to try to do something to a child. And so, um, hard to explain in every little area, but you can get the picture there, at how important all having
Hmm.
all the different sizes are.
If a parent has time to talk to a surgeon or has some time to consider options, are there things they should be looking for, like board certification, maybe their comfort level with the doctor?
Um, Absolutely. It should be, things like what the surgeon or the medical provider they're seeing, what their training and credentials are, should be readily available. But certainly, as a parent, asking those questions, not just assuming this person in front of me has had has had the training to take care of a child, but not that there aren't many that don't necessarily have that training, but I do think that what board certifications and all is sort of standardizes what that education should be and what it should look like, and certainly allow a parent to feel like they're getting the optimal care that their kid deserves. And so, my biggest message is just that children's health care is just not the same as adult health care. It's just there's so many different, uh, not just all the size differences, but the things that are wrong with them and the way we take care of them is profoundly different. And if you're not specifically trained in these areas, it's you're not going to be able to provide the kind of quality of care that they need.
What about pain management? I think some
Yeah.
parents worry, especially if their children are very little. How will I know if my child is hurting and how will their pain be managed?
Yeah, in children, one of the great things is I don't know if kids are just tougher than adults, but they do seem to handle some pretty complex surgeries and things, and they uh, seem to really have minimal pain issues. And just I don't know if it's their tolerance. Certainly, infants, some of the infant surgery we do, you would be amazed at. We give them a little Tylenol, and that's really all they need. And how do you really know? I mean, obviously, how do we sense is pain controlled, and the different things that we look at from their vital signs and other things of their exam that tell us. But it's just impressive to me that so much of their pain is controlled by the parent being there, holding the baby, swaddling them, feeding them when we can, when it's appropriate, and just how much of that really treats their pain. And
Mhm.
then it allows us to use very little, intravenous or oral pain medication. But just in general, we try to really avoid narcotics in children. We It seems that most surgeries we do, we're able to control pain with just basic Tylenol and ibuprofen or nonsteroidals, and that I rare on a monthly basis. I can count on one hand the number of times I have to prescribe, a narcotic. So we're really um, trying to avoid that in most cases. Obviously, there are very critically ill children and children in the ICU that are on intravenous forms of these narcotics sometimes, um, for the early phases after the surgery. But it's pretty rare that we send them home with narcotics. It's usually over the counter Tylenol and ibuprofen based pain medicine.
Hmm. Seems like that aftercare portion too could be another benefit of being at a children's hospital, having people who have worked with children who know what that aftercare may look like
Yeah.
and entail.
Yeah, no doubt. It's so you can take something that's very simple, and make it quite hard just from being at places where not everyone that's taking care of this patient does this every day. And the good thing about being here, I mean, we do a simple surgery. We call it a gastrostomy, or these feeding tubes that we have to provide for a lot of babies that aren't feeding well, for example. Very simple, basic operation, very complex, just overall care of that tube. And this is just one example, but we have just this team of nurses and providers in the children's hospital that teach these parents every little detail about how to take care of this thing over a couple of days. And because their kids going home with this new tube that has, lots of different components to it, and how to hook it up and use it and take care of the wound under and around it. And very important for, sort of how this functions for the child, and how they're able to use it and the safety of it at home. But there's probably hundreds of examples of that, but across other surgical and medical areas of pediatrics. But that's just one that kind of pops to mind, that is a true example of having a good team of people that do this, every day. It's we've got, standard pathways and ways that they take care of it, and becomes very important in terms of the outcome and the quality of what we're able to do for their child.
I wonder, I know we've talked about a lot here, but if there's just one piece of advice you give parents through this experience, what would it be?
Yeah, I just think my one piece of advice would be to take it serious, to take the health care of their child serious, to take the complaints they have serious. And sometimes it's hard to pick up on that their child is sick, or there's this condition. Um, Kids are sometimes hard to read. I mean, well, some of them aren't talk. Some, infants obviously aren't talking, and children aren't able to always explain. To explain how they're feeling and what's going on with them. And I think that I encourage mothers, parents, to use their instincts, and make sure their voices as parents are being heard by the providers. And I think that's where, I know, as a pediatric surgeon, I find out a lot about what's wrong with the kid and just how sick they are by talking to the parents and by listening, because parents generally, they know, they can give you the answers to what's wrong with that kid. And so, other than that, and listening to themselves, and paying attention and taking this serious for their kid, but getting them to the right place. And of course, I think St. Francis Children's Hospital is the right place. It is a fabulous children's hospital and a children's healthcare system that we provide this kind of care to the children of Tulsa, as well as all of Northeast Oklahoma. And through the team of people we have here, we're able to provide that kind of quality care that parents deserve and need for their children.
Well, thank you very much, Dr. Berch. I know this will be beneficial to a lot of parents. We appreciate your time.
Sure. Thank you. My pleasure.
Thank you.